So good evening, everybody. I am very, very excited to have been invited onto this evening's hour, and I was trying to think about what I could get into just 10 or 15 minutes to share with you, and what would be the most relevant and helpful on this topic of coping strategies for the way we're all feeling and the couple of years that we've had with all the COVID pandemic and everything else. And we all know, as Sue was saying, it's been such a difficult time. My experience, particularly as a registered midwife, I qualified back in 2014, and coaching midwives and students from all over the world to actually improve their emotional health tells me that it is, in my experience, the midwives who are not even qualified yet or very newly qualified that are actually at the greatest risk from burnout and leaving. We've had so many reports and statistics that's come out saying that, so many midwives leaving those first 5 years of qualification after often extended periods of sick leave, stress, daily anxiety. So the work that I do as an emotional health coach is not about sort of saying that you've got to be free from mental health problems, you've got to be physically fit. Emotional health is the link between your mental health and your physical health, and anybody can benefit from improving their emotional health, because emotional health is about the connection between the way that you think and how you feel physically and how you respond. So if you're thinking about anxiety and stress, particularly in midwifery, I was saying to Sue before we came live, is that there's already so much pressure, to give evidence-based care, safe care, timely care. We're told from the very first year of being a student midwife that you're responsible, you are a autonomous practitioner, and you're responsible for the care that you give, etc. So there's already enough stress and pressure, and that is almost like just a given that you're in high pressured emergencies and high turnover of people coming through the service and etc. So what I find is, in addition to this crippling stress and pressure that we're under, like in normal times, add a COVID pandemic into that, and being frontline workers and worrying about our own physical health with COVID and that of our family and friends during this time. But then add in, an underlying physical condition or underlying mental health problems or emotional health problems like stress, prolonged anxiety, depression, and other things like this. You can really see how it would be totally stacked against you to like, how can I survive? So the work that I do, and actually what I'm doing now moving forward, is like a two-pronged approach. So the analogy that I give, it's like, to have a thriving garden, you need a healthy seed and you need healthy soil, right? So the soil needs to be rich and fertile with the right pH, and the seed needs to be primed and, ready to crack open and germinate and bloom into a beautiful flower. And obviously they're all blooming together and you get this beautiful garden. So if you think about this in terms of, our midwifery education, the maternity services that we're working in, we need to be healthy seeds. And we also need a system where the soil is rich and thriving. So what I do is I support midwives with their emotional health to be healthy seeds. And I also support maternity services, practice development midwives, PMAs, RCM reps, maternity managers and leaders to actually improve the quality of their soil, if so to speak. And it's something that I've been doing more and more actually in the last few months. And we can't blame the system so much as midwives are responsible for their own practice and for looking after themselves. And actually, when we realize, I am responsible actually for my own emotional health, I am responsible for what I believe and how I show up in the workplace and how I use my voice or don't, or how I advocate for myself and the people I'm caring for or don't. So we can't just blame the system and say there's no staffing and everybody's leaving and morale is low and everyone's off sick. Yes, these are massive contributing factors to the state of the system, I'm going to say. But also on the flip side of that, we have to each be prepared to take a degree of personal responsibility and say, okay, there are so many things that are outside of my control. So I'm going to get my pen because I'm feeling inspired. So there are so many things that are outside of our control, but there are certain things within that I have influence over as an individual. So on the outside circle of things we have no control and no influence over as an individual student midwife, or as a what I call a worker bee midwife, someone who's in the service and they're running clinics and they're on labour ward, or they're in their antenatal clinics. There are so many things like staffing, like COVID, like who's going to be the new head of midwifery when this one retires, or how many newly qualified midwives are we going to be able to retain this year. These are all things as individuals that are outside of our control, okay? But I can tell you the amount of time that these sorts of things keep us up at night and keep us panicking and keep us in that high state of anxiety. Like, what if I go into work tomorrow when there's no staff and I don't feel supported, and that particular midwife might be on shift, and oh my gosh, I just had that run-in with her that one time, and now I know she doesn't like me, and what if I pull the buzzer and it's for a silly reason again, and I don't have the confidence, my self-esteem is really low, I feel really struggle to put myself out there. So there are so many things that are outside of our control, but actually if we think about moving the next layer in, things that we've got no control and influence over. Okay, so this is the key one for us. There are so many things we have not got control over, like birth, full stop, actually. The whole perinatal period and birth. As midwives, it may or may not come as a shock to us to understand that actually we don't have any control over this, because this is physiology. This is someone else's body, you know, someone who we are caring for. And there is also another body inside that body, you know, growing or moving or not, sometimes as the case may be. So as midwives and obstetricians and anaesthetists and all the other members of the MDT that we work with, none of us have control over that birth and the perinatal period, okay, for the person we're caring for. But we have varying degrees of influence over that person's experience, you know. So we also can think, well, maybe she was always going to end up in theatre. Maybe that person was always going to, you know, end up with a forceps, or maybe it was always going to have that kind of outcome. I should have controlled the outcome. I should have made sure that all the variables were in place and that was meaning that this person was going to have a good experience. No, actually, we need to be framing that and thinking, did I use my influence? Did I work within my sphere of practice? Did I use my intuition? Did I trust myself? Did I pull the bell when it needed to be pulled? Did I speak up and say no, or speak up and ask why? And this is where where midwifery is this like art and this like intuitive science that all kind of blends together, because we do use so much of our intuition and in this scientific kind of model. So for me, this influence is what I really focus on when I'm working one-on-one with midwives and when I'm working with maternity services and teams, is around influence. And your personal influence is going to be different depending on what the situation is. But there's generally always something you can do about the situation you're in, even if it's just the way you're going to choose to think about that situation. Like remembering this is actually outside of my control. Spending so much time in this outside circle, worrying and brooding and ruminating and overly reflecting and really kind of tearing and overanalyzing is going to bring us so much unhappiness, because there's actually nothing we can do about these external things. But what we can do is we can influence and control the way we think about those things. And that's massive, massive. So this middle circle are the things that we've got full control and full influence over. And the things we've got full control and full influence over are what we believe, like about ourselves, our own core beliefs, our own like value systems, the way that we think. Are we thinking in positive, engaging and adopting a positive mindset? Are we engaged in negative, unhelpful styles of thinking, which might be leading to catastrophizing or second guessing, which is robbing us of so much of the work-life balance, as me and Sue were talking about before as well. You know, on our days off, are we overly worrying about going back into work again? We're not even in work yet, and already we almost convinced ourselves, because of that anticipation of how bad it's going to be, probably taking a relatively educated guess that it's going to be very, very busy. But actually worrying about how busy it is that actually helpful? When you're strategizing in your mind at like 3 a.m. and you're up worrying about lack of staffing and who's going to be on shift with you and whether you're going to know what to do if it's a breach and an emergency and you've not had a breach since you qualified or whatever, I'll ask you the question, do you actually feel any more in control when you are in that state of anticipatory anxiety? And for me, the answer was no. Trying to plan for the day that hadn't happened yet and sort of assuming the worst case scenario never helped me actually feel any more prepared when that day came, because as soon as I woke up, I was like, oh my gosh, it's today, and the anxiety just skyrocketed. So students can apply this when they're doing their exams. I've seen on Facebook a few of the students I'm connected with are doing their exams tomorrow. We're overly, revising, and we're worrying, and we're like visualizing in our mind what's going in, and all the words falling out of our head, and what comes out of our mouth is not what we've revised. So when we're doing that, we're like preparing for that high state of anxiety, that adrenal response in relation to the exam. So actually what we need to do is we actually need to harness that mind-body connection. And what we need to do is we need to imagine the best case scenario. It sounds really weird. It's so simple, it works. If you imagine yourself in that exam, or on that pending shift that you've got coming up, or that band 6 uplift meeting, or whatever it is, in advance of that day or that date coming, if you imagine the best case scenario, you imagine yourself in that interview just smashing it. You imagine yourself in the exam being so eloquent and so on it, and just saying exactly what you need to say, and the answers just flowing to you, and you see yourself relaxed and calm and smiling and being received well. It's like your adrenals, the adrenal response doesn't happen because you're telling your body there's no threat. I'm just going into this interview and I'm going to smash it. I've got this exam, it's going to go great. I've got this shift, maybe really busy, but I know I'll be able to handle it. I know I don't work alone. I know there's a buzzer I can pull. I know there's somebody that I can ask. There's someone on the end of the phone. So actually, one of the biggest tips that I can give you for people that are watching is this high state of anxiety is often created, and this stress is because of this anticipation of the worst case scenario. But if you're actually honest, how often does that worst case scenario actually ever happen? How often do you go into the exam and completely lose your train of thought and leave scoring a 0, which is what's been keeping you awake for weeks worrying about? Rarely happens. So actually, by imagining the best case scenario and visualizing what this busy shift or this stressful situation might go like in the best, if you could wave a magic wand, actually it will reduce your anxiety and anticipation, and will actually set you more up to succeed than the endless worrying and overthinking in advance to try and remain in control of a situation that hasn't happened yet. I hope that makes sense. So when we're thinking about like resilience and bounce back ability, and resilience is such a buzzword in midwifery, actually what we should be aiming for is this ability to bounce back. And bouncing back is not like an elastic band where it like twangs back straight away. Sometimes it takes time, but none of us are not resilient enough. We're not struggling with midwifery at the moment because we're not resilient enough. That is not what's going on. Even the best, most resilient midwives are going to have like the downtime from that twang. So resilience and bounce back ability is about the ability to bounce back after adversity or after stress, taking the downtime, learning the lessons, and coming back to kind of where you were before, if not being more along for having reflected and learned the lessons of what it was like when you were burnt out and having that downtime. And that actually is resilience, that ability to say enough is enough, and I need a little bit of time. I need some time. So another thing that I wanted to share with you is something around confidence. So we've said before that the stress is massive, there's so much pressure, and so many newly qualified midwives especially feel like they have to know it all. They're terrified of making a mistake, again, because the stakes are so high. They might be struggling with perfectionism, with fear of failure, with procrastination, and with people pleasing. And these were all traits that I really identified with, but they were not personality traits. The perfectionism, the procrastination, the people pleasing, they're not personality traits. These are learned behaviors. These are learned behaviors, and that you can overcome them through understanding more about your emotional health and the impact that the way you think has on the way that you feel and the things you believe about yourself. So the thing about confidence and self-esteem is that people think that the two terms are interchangeable, and they often use them to kind of mean the same thing in that context. But actually, confidence and self-esteem are different. Confidence is that almost like a mask that you wear. You can fake confidence. It's like the swan, gliding on the water, and the feet are going under the water, 10 to the dozen, like paddling away. You can fake that you've got it all together. And actually, as a first year student, often aren't we assessed on our ability to like strike up a rapport and keep the person calm and look like we've got it all under control? And So we're actually assessed on our ability to look like we know what we're doing, even if we don't really know, just to put the person we're caring for at ease. And you can fake confidence, but self-esteem is internal. Self-esteem is linked to the value that you place on yourself as a person. It's linked to how much you celebrate your successes, how much you accept your weaknesses and commit to working on them or not. So actually, if your self-esteem is low, you can't fake that, because it's linked to the way that you speak to yourself in your head, that inner voice, that inner critic, or the inner best friend, the inner champion that we ideally would like to be cultivating more, to be more compassionate and caring towards ourselves rather than nagging and berating ourselves all the time. We're actually, probably compared to other people, we're doing just as good as them, but it's that rose tinted glasses that you look at other people and think, oh, they're doing so much better than me, she's doing this and this. It's all down to perception. So something that I heard the other day, which I love, is when we're thinking about perfectionism, and we're thinking about fear of failure and having to do our best all the time, and shouldn't need to ask because I should know, this massive pressure, is that actually 80% of the time we just need to be good. 80% of the time we just need to be good. So good means safe. Good means giving it a good try. Putting some good effort in there. And ticking some boxes, getting some stuff done. So 80% of the time we just need to be good. And then the other 20% of the time we'll call for better and best. Okay. But so often don't even tell small children. I've said it to my own son, just try your best, just do your best. No one can ask any more than doing your best. But the best is this thing about pushing. I'm striving for the best all the time. The women deserve the best. The people deserve the best in our care. Yes, they do. But actually, we need to be healthily lowering the bar and almost resetting the bar to say, we just need to be good. We need to be good enough. And obviously what good enough looks like is going to vary from person to person. But actually, my personal challenge for myself, as well as the midwives that I support, is that we just need to be good enough. And actually, good enough is healthy, because good enough allows for errors. It allows for asking for help. It allows for making mistakes. And then when the better and the best is called for, we can rise to that occasion, because our stress levels and our anxiety levels are not excessively burned out from the pushing for the best all the time. So I really liked that. And I think in the midwives and the students that I've shared that with, it's kind of brought them quite a lot of relief. And they're like, gosh, so I can maintain my self-esteem actually really well by just being good 80% of the time. I don't have to be the best all the time to feel like I'm actually good enough to be a midwife, because I don't know if anyone who's listening to this or watching can relate, but for me, I struggled with massive imposter syndrome when I qualified as a midwife. I was convinced it was only a matter of time before someone was going to tap me on the shoulder and was like, oh, hi, is this a mistake? What are you doing in the blues? You need to get out of here. And I was literally convinced that, that tap on the shoulder was going to find me, because I'd put so much of my skills and accomplishments down to luck, chance and fate, being in the right place at the right time, or, not really actually internalizing the blood, sweat and tears that it took me to qualify. And I did so much of the mentors that had trained me a disservice by thinking they were just going to sign me off, So you are not an imposter. You have worked hard. You have that essence in you, what I call the midwife essence, that essence in you that calls you to midwifery. And maybe it's become a bit diluted, or a lot diluted, and you're losing sight of your passion and you're saturated and burnt out, but you have it. And if you've already had it because you were given a place on the program in the first place, okay, or you did your nursing conversion to midwifery, you wouldn't have had a place if you didn't have it. And it's actually easier than you think to thrive. And the way that I see is that we need to support the midwives to do their bit, to take that responsibility, to embrace their emotional health. And we also need to support our maternity services and our education system as well to refertilize their soil. So we need healthy soils, healthy seeds. We're going to have a thriving garden and a thriving maternity system.